you, Mr. President. I'd like to again ask the Minister for Health and Social Care what provisions he has to improve the provision of fostering services.
Minister to reply.
Thank you, Mr. President. On the 1st of October 2018, the Combined Family Placement Service, including fostering and adoption services, transferred into the Department's Children and Families Directorate. This was as a result of premature notice given on the contract by the Isle of Man Children's Centre in January. Prior to this, fostering services had been externalised since 2010. The Department decided in March not to conduct a procurement exercise and to bring the services back into the Department following consultation with foster carers, staff, children and young people. The Department's aim for adoption and fostering services are that, firstly, children and young people in care are supported to build trusted and secure relationships with foster carers and achieve a sense of belonging and permanence with them. Secondly, that foster carers benefit from multi-professional support and training, which enables them to become multi-skilled specialists, providing high-quality care and are respected as part of the professional team working with children, young people and families. Thirdly, that there is a sufficiency of placements, not only in numbers, but that are matched to the demographic needs of the children and young people in care. To achieve those aims, the Department must ensure that leaders, managers and staff work within a system that has clear responsibilities and accountabilities, provides efficient development, supervision and support for them to be up to date with the best and most effective practice that they can then share with foster carers. The decision to bring this service back into the Department was informed by consultation, and the changes outlined just now and all developments will continue to be consulted upon with foster carers, staff and children and young people.
Thank you, Mr. President. Again, thank the Minister for his comprehensive answer. Can he clarify how satisfied he currently is with the state of the fostering service, and if he isn't, what timescale and plan for change he is implementing within the Department to deliver it so that this crucial service for our vulnerable young people is fit for purpose? And furthermore, can the Minister confirm that the interest of the child will be the paramount factor in new fostering arrangements?
Reply, sir.
Thank you, Mr. President. Taking the last point first, the interests of the children has always got to come first. It is at the end of the day their service. So their interests have always got to be at the heart of what we do. In relation to the state of the fostering service, there are some challenges. I'm not going to shy away from that. We've taken the service back in-house and we've been assessing how we move forward. As I said in my original answer, Mr. President, there's several things that we want to do, but I'll give some examples to the Honourable Court of the real challenges that we're currently facing. So, for instance, the service has not had a permanent manager since the start of the contract in 2016. That has been in a position long enough to become what would be classed as a registered manager as required by minimum standards for registrations and inspections purposes. That's something that we need to tackle as a matter of urgency. At the point of transfer, 3 of the 4 management and leadership posts were also vacant. So again, that's something that we need to tackle, and 3 of the 6 supervising social work posts were vacant as well. While we can get agency staff to fill in, Mr. President, that doesn't give the consistency and stability that the service needs. And it's very, very crucial that if we are going to have a well-run service that supports foster carers and, as I said, is child-centric for the children, they've got to have that feeling of consistency and stability. And that is one of the things we'll be looking to drive forward. We'll also be looking as well to find new placements and expand the placement offering. And obviously, one of the things that we will also be looking at is the length of times in relation to placements and ensuring that children and young people get that consistency of service that they desperately need.
Honourable Member for Council, Mrs Paul Moulton.
Thank you, Mr. President. And I'd like to thank the Minister as well. It's very pleasing to hear what he's just been talking about in terms of the child-centric approach and the importance of consistency and stability. I was also pleased to hear about that part of the work that's going on at the moment is to provide better training and support and skills for foster carers. He may not have this information to hand at the moment, but I wonder if he would be kind enough, if he doesn't have it, to circulate it, to let us know or explain whether that training and support is such to really equip foster carers to deal with actually the quite traumatised young people that they deal with. It's my understanding that a lot of foster placements break down because there are practical skills given, but actually understanding issues around trauma and attachment and the emotional needs of young people and their behaviour is an area that foster parents have perhaps in the past been ill-equipped to deal with, and whether the work that's going on now will really seek to address that to maintain consistency and support.
Minister.
Thank you, Mr. President. Most certainly, training is very vital, and we will be looking to expand the services offered in terms of training to foster carers. My personal view has always been that every child is unique and should be treated uniquely. They shouldn't be boxed off as if they're a problem child or they've got various problems. We should be looking at the circumstances of each child we place, and training is very important, as the Honourable Member for Council has said, but what is equally important is that there is proper, stable, ongoing support as well. We don't want to end up with a situation where training is delivered and then it's sort of over to you, to the foster carer. There has to be that stability of support. So when we talk about having to make sure that we get full-time recruitment in place, that's not just for the support of the child, it's also for the support of the foster carer.
Honourable Member for Ramsey, Dr.
Thank you, Mr. President. I'm very grateful to the Minister for his statement about fostering services. Would he agree that the lack of continuity of care in the past has led to severe difficulties with foster parents, and so that having a stable social work department is essential to bring the service forward? But would he also say that that stability of support will help rebuild some of the trust that has been lacking in previous organisations? And would he be able to make a comment about the increase in communication between the department and foster carers so that they're aware of the needs of the children that they're asked to care for?
Minister.
Thank you, Mr. President. What we're wanting to do is design a full comprehensive service. The Honourable Member for Ramsey there used the word trust, and that is absolutely vital. There has to be those links of trust between the foster carer, and I'll be perfectly frank, I don't think that always has been there in the past. By getting stable relationships built up by people in full-time posts, that benefits not just the child, but also the foster carer. People understand one another. The foster carers are understood by their link into the department, and the link from the department understands the foster carer and the needs and demands. Stability across the whole of health and social care, not just fostering, is absolutely vital in any of the care that we deliver. That people feel that they've got somewhere to turn to when they need help and support, and that is precisely what we'll be trying to do with the foster service.
Honourable Member for Council, Mrs Lord Brennan.
Thank you, Mr. President. Mr. President, yesterday I was talking to somebody who'd been...
Could we just have a question?
Sorry,
I don't want a long preamble.
No. Well, the result of that conversation was, will you look to improve the communication in the lead-up to a child being placed? And also, would you look at foster to adopt again? Thank you.
Minister.
Thank you, Mr. President. Foster to adopt is something that can be looked at, but at the moment, obviously, we want to get a stable service in place first. I think one of the key things in relation to the Honourable Member for Council's question there was mentioning about the sort of pre-placement period. And I think that is just as crucial as the placement. You want the child to feel comfortable going into the environment they're going into, and the foster carer equally feeling comfortable with the child that they're receiving. So it is a two-way process, and it is important that the communication is absolutely spot on, and that help and support is provided, not just from the point the placement happens, but also preparing that placement both for the child and the foster carer, and that will form part of it.
Final supplementary, Mr Baker.
Thank you, Mr. President. Final supplementary from myself. Could the Minister clarify whether his aspirations for the fostering service will be constrained by the wider financial pressures facing his department?
Minister.
Thank you, Mr President. I'm full of aspirations, I can assure the Honourable Court. And in relation to fostering, I know that the Children and Families Division are working well. In terms of budget, I can say to the Honourable Court the Children and Families Division is doing very well with their budget. And I believe we have a huge opportunity by bringing the service back in-house to make sure that we've got a proper joined-up approach that delivers benefits for the foster carers and, crucially, for the children, making them the centre of the service that we're delivering.